Thank you. Well, menopause can be rough for many women in their 40s and 50s, from hot flashes to insomnia and brain fog. It can come with a lot of unwanted symptoms.
Today, Sarah Block, a nurse practitioner in obstetrics and gynecology with SSM Health, is here to talk about treatment options that may help you manage menopause. Sarah, thanks for being here with us.
Thanks for having me.
Important topic.
So what are those common symptoms women should be looking out for?
It's a great question. So any person that has or had ovaries will experience some level of perimenopause or menopausal symptoms. There is no blood test to let us know, how severe or when you're going to experience these symptoms. When you think of perimenopause or menopause, you think of the classic hot flashes and night sweats, vaginal dryness, change in menstrual cycle, but there's a whole list of other lesser known symptoms. And those can include headaches, hair loss, sleep disturbances, irritability, brain fog, skin dryness. The list goes on and on. It can be a very distressing time.
Yeah, and some of these symptoms can be pretty intense for some women. Is that the same for all women? Do we have varying levels of it?
Luckily, most women can have mild symptoms. Some will have symptoms for a few months and mild, and then they go away. Others can have life-altering symptoms that can last for 10 years or more. The first signs of these symptoms typically in our 40s, but can be as early as age 35 and can last well into our 50s and 60s.
Women might think this is just a part of life, something they have to endure, but there are treatments available. Tell us a little bit about those.
Absolutely. So it's an expected part of aging process, but luckily we have very effective treatments, namely hormone replacement therapy. We do know that hormone replacement therapy is very, very safe. There was a study done about 20 years ago that put a lot of fear into providers and women that it causes breast cancer. We now know that study was done very poorly, and now we know there's no increased risk of breast cancer unless you've been taking for more than 5 years, and even then the risk is still low.
That's great information, because I know that was a concern for a lot of women. If they still don't want to take the hormone replacement therapy, what other alternatives are there?
That's great. So from my perspective, because hormone therapy is so safe and most women can be on it, I would talk to your provider about hormone therapy for any woman. There aren't any scientifically proven remedies for hot flashes and night sweats outside of hormones. But for vaginal dryness, we have options, moisturizers or lubrications. But for the most part, hormone replacement therapy is great. We do know that stress reduction can help reduce the severity and frequency of hot flashes, and a healthy diet and exercise program can also help with symptoms.
And just good recommendations
Yes,
for life
for all
in
of us.
general.
Always.
And when we're talking about age of when women should start thinking about maybe getting checked for it, or when we might start seeing symptoms, I know you said 40s, it can even happen in our 30s. When should we really start thinking about it?
So when you start to experience these symptoms like we talked about, that is a perfect time to go talk to your provider, because the earlier we catch it, the better off you'll be, the healthier and more quality of life that you'll have. So it's never too early to talk about it, and always go in a little prepared. And then, like I said, there's no blood test to let us know, but because we treat based on symptoms, which sounds very Western medicine of us, but we're actually treating the root cause, which is the depletion of hormones.
Okay. Well, great information to know. Thank you so much for being here and sharing.
Thank you for having me.